I'm not hungry. This is really weird. That was revelationary to me in my mind. It was like for the first time I had this sense of satiety that I'd never had heretofore. And that it just put in my mind that, man, maybe some of this nutrition stuff isn't all that crystal clear like we thought it'd be. And I was like, wait a minute, we can actually impact these people's lives in a way where they don't need a surgery.
Dr. Shawn Baker, a former surgeon turned carnivore diet advocate. How did a top athlete and disciplined doctor end up ditching vegetables and questioning everything about mainstream nutrition?
Hi everyone, Dr. Eric Westman here, and welcome to my channel where I typically review and debunk nutritional information online, but occasionally I have the great pleasure to interview the people who I think are the movers and shakers in the nutrition and keto and low-carb carnivore worlds. And so when you look and talk carnivore, there's one name that comes up, one doctor, it's Dr. Shawn Baker. Welcome to the YouTube channel.
Hey, Eric, thanks for having me. Speaking of movers and shakers, you've been doing this for a heck of a lot longer than I have, and I certainly all respect to you for pioneering this sort of way of thought for, gosh, many, many decades now. So thanks for all you've done.
Well, you're welcome. You know, for my first part of my career, I was working with a brilliant PhD in the smoking cessation world, and my job was really to kind of keep him safe because you'd have all these great ideas, and now I feel like I'm trying to keep you all safe with all these crazy nutrition ideas. But yeah, we started studying. Started studying this 25 years ago, and you know, I got into this by patient care. Two of my patients did it in front of me. Why don't we start? Assume that someone doesn't know who you are, where you're from, what you do. How did you get involved in this? It started with your training, and then how did you get involved in being the kind of the carnivore lightning rod at the moment? And
before we dive into today's video, I want to personally invite you to join my free diabetes lab workshop. In this essential workshop, I'll walk you through how to understand your lab results so you can take control of your health and reverse type 2 diabetes and prediabetes for good. See the link in the description to sign up.
Yeah, well, yeah, I mean, I was a conventionally trained physician, you know, my specialty was orthopedic. So I'd say, you know, I practiced, had a fairly, you know, sort of standard career for much of it. I mean, I spent some time in the military, did a bunch of kind of trauma surgery before I went into my own sort of private type practice. And, you know, it wasn't until I was probably in my early 40s where I took a greater interest in nutrition solely for personal reasons, because I just wasn't happy where I was health-wise. I've been an athlete my whole life. I'd always trained and exercise, and, you know, since I was a teenage kid, I've been doing it, and I still do it. But, you know, my health was just going in a direction I didn't like it. I was probably developing some level of metabolic disease. I was feeling my 40 some years of age at that time. As an aging athlete, you got a lot of mileage on you. And I didn't like that. And so I started playing with let me just go on a diet, really the first time I'd ever thought about dieting in my life, because I'd always, you know, been able to compensate through exercise, and I ate a lot of protein, and I just didn't eat a bunch of junk. But so I made a concerted effort to really focus on diet. And I went on this, you know, basically a low fat, high fiber, vegetable heavy, lean protein diet. And I lost weight. I mean, I went from at the time I was walking around at about I'm a big guy. You've met me, Eric, you know, I'm a pretty big man. I was walking around at about 290 pounds at about 6'5", and I'd been there about 20 years as an athlete, and I needed to be that because I was competing in these strength sports. And so I dropped from that down to about 230 in a course of about 3 months. But it was, you know, exercise 3 times a day, severe caloric restriction, you know. I mean, the food was quote unquote healthy. It was, you know, chicken breast and salads, and I was jumping rope, a couple thousand jump ropes in the morning before I'd go to my work, go to the surgical practice. Then at lunch, if I had a clinic day, I'd run in and get a quick workout in over my lunch hour. And then at night, after I put my kids to bed, I'd do another couple thousand jump ropes. As you imagine, that's not sustainable, right? And so I was like kind of miserable. I was lean and I looked good, you know?
well, but so you said so much in there. So you trained as a physician, Did you, go back to your medical training to figure out what then to do? I mean, or did you, like me, get very little nutrition training?
Well, I mean, yeah, I mean, the prevailing thought, and it still is today, is, it's all about calories in, calories out, and it's all about, if you look at the USDA recommendations, it's just basically, fill your plate with a lot of vegetables and grains and lean protein and minimize the fat. And I kind of did that. And I don't disagree that it can work. It's very hard to sustain. It's very hard to deal with constant hunger. And I mean, I remember the nurses like, gosh, Dr. Baker, we liked you so much better when you were fat. They kind of said playfully, because I was grouchy. I mean, I was just like, I was just hungry all the time. So then I said, well, I can't do this. I just can't maintain this. I'm a disciplined guy. But
Sorry, I just have to editorialize just a little bit. And that is, you know, as physicians, we actually, we've gone through high school, we've gone through college, we've gone through medical school, sitting on the behinds in lectures, and you had to be in the OR learning how to not even itch your nose if you had a mask on. I mean, so can you imagine asking just everyone to do what you did? to be hungry all the time and to have to exercise so it's like you were already selected out to be able to do something really difficult, and you did it.
yeah, I mean, I don't lack for discipline. And I'm fine, I don't, it's obviously you prefer to be more comfortable in the long term, but so I did that, and then I discovered that I can't maintain this. There's no way I can do this for the rest of my life.
Even you
Yeah, even a guy who's almost psychotically obsessed with performance and some of this, I just couldn't see that as being something sustainable for me.
So that I kind of just make the comparison and contrast to the average person who comes to the office.
Yeah, that's for sure.
Many of them haven't even finished high school. So, I mean, they couldn't sit in class, and to ask them to do what you did, what many doctors do, it's just not practical, right? It's
I
just not.
100% agree. I 100% agree, Eric. So from there, I discovered some of the low carb thought. I think the first book that I read was Gary's book, Gary Taubes' book, Good Calories, Bad Calories, and
Yeah.
it just put in my mind that, man, maybe some of this nutrition stuff isn't all that crystal clear like we thought it'd been. It cast enough doubt in my mind about the whole, the value of nutrition science. It's not that there's no value there, but there's a lot of flaws within it. There's a lot of assumptions, and a lot of the associations are very, very weak. And so at some point discovered the low carb stuff, the keto stuff. I did that. I remember when I went keto for the first time, I was super excited because in the first time in my life ever, and I was probably mid 40s at that time, I wasn't hungry, because I was a guy that was used to putting down 6, 7, 8,000 calories a day as a big athlete. I would go to a restaurant, and I'm not exaggerating. I'd eat two appetizers, maybe three appetizers. I'd get a couple entrees. And then for dessert, because I couldn't decide between the red velvet cake and the cheesecake, I just get them both. Right. I just ate a lot of food because I was a big guy and always hungry. And then I just remember the first time going like, wow, I'm not hungry. This is really weird. That was revelationary to me in my mind. It was like for the first time I had this sense of satiety that I'd never had heretofore. So from there, and this is the interesting thing for me, I was still practicing orthopedics at the time, full time. And we had a situation where we just had a lot of obese patients that needed knee replacements, right? That's just what you see. That's what the population looks like typically. And unfortunately, these patients are at higher risk for complications. They had higher risk for blood clots and infections and, just poor overall rehab. And so as a local community of orthopedic surgeons, we all got together and said, hey, we got too many people that are struggling with this stuff. Let's all agree to not operate on people with a BMI over 35 unless we've done X, Y, and Z to get them to lose weight. And so we all agreed to that. So one person didn't just take all the people that were obese. And so, but they didn't give you any guidance. It was like, okay, get your patients to lose weight. Good luck. You know how that goes. And because I was doing a ketogenic diet at that time and had good success with hunger, I started proposing it to my patients. And, maybe 25% of the people would take me up on it and actually do it. But the thing that really blew me away was that in that cohort, I would typically say, here, here's a diet, here, read these books, here, watch these videos, try this diet out. And it was, the people that would do it, often they would come back to me at the 2 week point because I would follow up in 2 weeks to see how things were going. How's your diet going? Um, and very often they would say, doc, I know we're scheduled for a knee replacement, in 2 months, but my knee doesn't hurt anymore. And that was what I was like, wait a minute. Well, and I would say, well, you know what? If your knee doesn't hurt, there's really not a good indication to do surgery at the moment. So as long as you keep on your diet and it's working for you, you don't need surgery. That to me was a light switch moment for me. And then I got really excited because by that time I had done thousands of surgeries. I'd done hundreds and hundreds of knee replacements, gazillions of knee scopes. And I was like, wait a minute, we can actually impact these people's lives in a way where they don't need a surgery. Because even as a surgeon who liked to operate on people, if it was me, I'd rather not have the surgery. I think most people feel that way. If I could avoid a surgery, hell yeah, I'd rather avoid it. So that's what kind of got me into this sort of place. And then from keto, I ran into this wacky group of people just eating only meat. They call themselves a zero carb group, zeroing in on health. And it just sounded so bizarre. What do you mean? Where's your vitamin C? Where's your fiber? Where's your phytonutrients? All that stuff. But I was already sort of, bought off on the low carb being beneficial and not terrified by, fat. I wasn't there anymore. And so I was enough to the point where I said, you know what, I'm just going to try it. This is 2016. So I tried it for 30 days and I was just like, I just feel great. I mean, even more so than I felt on keto, believe it or not. I mean, I just had my digestion was better. I just felt like I was a little less inflamed. I got a little stronger, which was cool as an athlete. And so I've been there since then. And I've kind of just been promoting this carnivore diet. I wrote, obviously wrote the book on that for the last, I guess now 8 years I've been doing this. And this is I'm starting my 9th year of this stuff. It's been interesting. I tend to say, look, this is a therapeutic tool. I don't care if you want to get a tattoo and call yourself Carnivore Carl, that's up to you. But I mean, as far as from the physician side, and you probably see this as well, it has such dramatic therapeutic potential that we should at least be willing to discuss it with our patients. And if they want to do it for 3 months, 6 months, and it helps them significantly, good for them. And then you can figure out long-term what they want to do. Some people decide they want to do it long-term. Other people they incorporate a few other things back in there, and many of them are still fine with that. So that's kind of where I'm at right now.
So how did you get the idea that this might help other people too? I mean, I guess you learned it from a group that already was.
Well, yeah, I mean, I'd already seen people it was seeming to help. The only reason I tried is because I saw, it's like, no one wants to be the first guy to try something. Let me see how these guys are doing. So I'd known there's some people that were doing it, and they were making pretty, what it would appear to be at the time, extraordinary claims. Oh, my depression got better, or, things we as physicians would kind of scoff at. Oh, what? You had a diet and your depression went away? Get out of here, dude. Or your arthritis got better. We would kind of ignore that. I can remember specifically years ago, I remember I had a lady coming in and telling me how Brett hurt her knees. And I started looking at her allergy list and she had 15 allergies. And you're one of these kind of wacky patients and everything. He's kind of, you kind of compartmentalize these patients as they're a little bit strange. I'm going to kind of take what they say with a grain of salt. When do you want to schedule your knee scope type of thing? But I'd heard enough people doing that. And so I was on social media at the time, on Twitter at the time. And I had not the account, not the size that I have now, but I had, a few thousand people that were following me. And, we were talking about it, kind of goofing around saying, oh yeah, I'm going to get scurvy or my heart's going to explode or something, blah, blah from that. And so I managed to convince, believe it or not, in 2017, I convinced 100 people to do it for 90 days. And we actually recorded the data. We call it, because we said, well, it's an N equals 1. It's not, it's good, it's cute, it's good for you, it's N equals 1. I said, well, let's call it N equals many. So many people, we got 100 people to do it for 90 days, and we tracked their data. Average person lost about 30 pounds. Their heart rate went down by 10 points. They lost 8 centimeters off their waist. And then everything's subjective, because we didn't have any money. Everything we could measure subjectively got better. Digestion, sleep, mood, libido, skin, whatever. All these things got better. And so that's, kind of where that started. And then I started collecting those. Yeah.
In that first 100, so 100 in a row or selected, what percent had success?
Almost all. I mean,
well, I know it's everyone.
Wasn't all of them. I mean, I didn't, it wasn't a formalized study. It was more of a survey.
So basically you do it, it works.
Right. Yeah.
Right. So now we compare it to studies where, the professor gets 300 people assembled together and people barely do it, or they try it. They teach a difficult way of doing it. That's what happened at Stanford. They didn't ever ask anyone who used it. And then, people fall off and they can't see, no one can do it. Well, no, if someone can do it, it pretty much works, right? So, so I see I guess you weren't thinking of carnivore as an elimination diet at that time. It was just healthy eating. You felt great and helped you be fit rather than a medical treatment.
Yeah, I mean, I think it was still emerging thought on this. And I think it's still, I mean, to be honest, I think it still is. We're still trying to figure out some of this stuff because we just don't, as you know, Eric, there's very little money for nutrition-based research when it comes to mitigation of disease. It's all drug, 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 drug. So it's a slow process to get funded, to get the studies done. But yeah, you're absolutely right. I mean, it's like, because the question I have, I mean, in my mind, there is zero doubt that this can help people with with lots of conditions. Now, the question is, does it help 80% of the people, 20% of the people? We don't know that yet. And that's where the next phase will be to start doing interventional trials. And, keto's got a fair bit of that already. So this makes sense.
We're following another grassroots area where people with type 1 diabetes, or the parents of people with type 1, are doing a similar low carb. And I see carnivore as another version of low carb,
For sure.
keto. It's and they had such great results. We surveyed their Facebook group, and it was published in the journal Pediatrics. And similarly, there was a carnivore group that got surveyed and published in a paper. But the rebuttal that came back from someone I knew, someone in academia, said, well, those were exceptional people. Those were exceptional families and exceptional children, and no one really can do that. And I don't really agree with that. In fact, I'm thinking now that it's kind of almost malpractice to not offer some kind of dietary change, because the arrogance to assume that someone can't do it, well, of course, if you teach it in a difficult way. So carnivore has the easy idea of what to eat. So that takes away the worry about making complicated meals, although you can, and make it delicious. But I wonder if the adherence. So let's say you've gone from one you to 100, and now even on my YouTube videos that I do, I have to assume that these aren't people lying, and yet there's with benefits, right, of not eating vegetables, and but there's a difference between these internet anecdotes and carefully assembled clinical trial. You're vetting out, making sure someone actually had that experience. Even with the type 1 Facebook survey we did, we verified the blood tests that people self-reported to be sure, talk to the doctors and got the clinic verification. But, I guess, as this grassroots, so people are not eating vegetables, and there's a lot of preclinical reason why that would work. And I certainly seen diabetes reversal and all these medical problems go away. What's the next step to formulate, what percent will have benefit, and how do you teach it so that most people will be able to do it? And I followed, and in fact was an initial investor in your company that teaches this. What have you learned from now, in the trenches, implementing this with people?
Yeah, let me just one comment. When we're talking about the ability to sustain or actually do this. I mean, I remember an interaction I had with another physician that says, I don't want to fight my biological urge to eat a cookie. And I'm like, that's not a real, cookies never existed. I mean, if you're looking for cookies don't even exist. So that's obviously not a biological necessity by any means. But as far as, as you probably are aware now, thankfully, and I've been talking about this for a long time, and I know you have to some degree, Eric, but we always saw low carb and ketogenic diets as weight loss diets and maybe diabetes management. But there is so much more which it impacts: mental health, inflammatory conditions, autoimmune conditions. So I see this every day. So now we're getting more and more people saying, hey, look, not only is it not just a weight loss diet, And there's a lot of ways you can lose weight. I mean, you and I would both concede there's lots of ways you can lose weight, but some of these things uniquely seem to have additional benefits with regard to, some of these other conditions. And so now,
Well, some are easier than others. Like you white knuckled through low calorie and exercise.
right. Yeah. I mean, it's a lot easier when you don't have to rely on discipline, and you can
You're not hungry.
rely on your physiology a little bit. It makes it a lot easier for sure.
And is that so? The appetite going away is something we don't talk about a whole lot. We kind of just assume that people know. There are a lot of people who don't know that, right? They're watching this for the first time. They're thinking this is kind of crazy, but the fundamental difference once you start fat burning, your hunger goes away. And in that group of 100 people with results, I'll bet that was universal.
Yeah, I don't remember specifically that particular asking about satiety, but I've seen that this is one of the more common things I see is people that talk about cravings and addictions. They'll say, for the first time I ever found the off switch. I remember talking to a gal who was 800 pounds, everything. She couldn't stop eating cookies and candies and sweets. I went carnivore, lost 500 pounds in 2 years. She said, I found the off switch for the first time in my life. And she's somebody that failed gastric banding procedures and things like that. So, yeah, I mean, of course, now with the new GLP-1 drugs, people are more in tune with satiety, and these drugs act in many ways. But this is something that is,
You don't need a drug.
well, the same thing with, talking with, I'm sure you're familiar with Ted Naiman and Andreas Onfield and their HABA, where they're talking about satiety per calorie. And a carnivore diet that fits right in there perfectly. I mean, it's the perfect way to get satiated. Your point, though, your initial question was about how do you implement it? What have been early results? I mean, gosh, you've had so much experience in this. I just talk to people about, look, even if you're obese, whether you're obese or not, many people come to us malnourished in a way. And the definition of malnourishment is not necessarily underweight. It's just not the right amount of nutrition, the correct nutrition. And so they may be missing fat soluble vitamins or not enough protein or who knows, certain minerals that are low on. And so if you give them whole, unprocessed, very nutrient rich foods, a lot of times that helps them to meet those nutritional needs so they're not hungry all the time. And so I tell people, how much should I eat, Dr. Baker? Well, eat enough so you don't want cupcakes or whatever the junk food is. And that's kind of their initial guidance. And you just tell them, you've got to eat enough to overcome those addictive behaviors. And that might take a few months. And then once you get there, then you can kind of play with macronutrient ratios and meal timing and meal sizes and portions. But it's a lot easier when you're not dealing with this psychological nightmare of addiction. I think that's the first step. I think when you're treating chronic disease, you are probably in many ways dealing with some sort of ultra processed food addiction. I think that's, if you don't realize that, you're going to be spinning your wheels. And so you've got to be prepared to do that. And this is, and you mentioned Rivera, our company. And so what we do is literally, we'll be in contact with patients on a daily basis as necessary, because some of them need it. Some people you can say, hey, go read this book and have at it. And some people do great, but there's a lot of people where they just need that handhold. And, there's some people that you got to just keep answering questions and reassuring them and remotivating them and, giving them the knowledge to continue to do that. And so we found that that's been very helpful. I think that's when I was practicing as an orthopedic surgeon, I was kind of waking up to this. Wait, nutrition's important. I had no resources. I mean, there's no one I could send them to. The best I could do is go watch this YouTube video. Here, go read this book or watch this YouTube video. I had no time to talk to these people. I mean, I was lucky to get 5 minutes to see my patients. I was in a busy orthopedic clinic. A 15-minute appointment would be a luxury. I usually have 15-minute appointments. I'd be double booked all the time. It's like, oh, okay, well, I got two of you guys in 15 minutes. And it's just like, I felt like I was on roller skates in my clinic all day. It was fun running back and forth. But it's not a good way to do medicine, as you know. I mean, you slow it down and say, what are we actually doing here? Let's heal the patient rather than healthcare has kind of devolved into this disease management, symptom whack-a-mole. And that's not what we sign up for as doctors. I mean, I'm sure you feel the same way, I would imagine.
Yeah, I at a VA, Veterans Affairs Clinic, learned evidence-based medicine and clinical trials and was frustrated and and not happy with the tools I had. We managed diseases, and I like to fix things. I'm a DIY kind of guy, you know. And now I love YouTube. I can just go and look, what tool do I need? How can I do it? So it wasn't rewarding for me as a doctor, as an internist. Now, as an orthopedic surgeon, you could just fix the knee, and people, you know.
That's one of the reasons I went into orthopedics, because I remember as a medical student rotating through my primary care specialties and watching how miserable the doctors were. They were complaining because the patients were never, oh, the patients are not compliant. They never get better. They were beating their head. And I was like, orthopedics, somebody breaks their leg, I stick a metal rod on them and I'm done. Good.
But think about that. It's kind of a selection bias. So it's a fait accompli. It's it's kind of the depressed people go in and they can tolerate other depressed. So, the classic difference between internists and surgeons, you want to fix things, and a chance to cut, so a chance to cure. And then we're just kind of, oh, well, I think the saying was, we're the last to get off a dying dog, the fleas, right? We're called fleas. And so that's the stereotype. But when nutrition is the key that we, neither of us really got in training. Even today, there's not much training about nutrition. So, but that could make us vulnerable to doing things that aren't healthy or aren't safe. I mean, so being in this world, watching people do the carnivore diet or versions of that, what have you learned for the safety limits of it? Are you worried about, you're on the edge of the cliff, someone's going to die, or are you, how far from the cliff are we?
Well, again, I've said this many, many times. There are many ways to get healthy. Carnivore is a tool in the toolbox that you should use when necessary. I think some people are more appropriate for others. It's simply for the point that many people don't need to do it. There's a lot of people that could just remove some ultra-processed garbage out of their diet and their health would dramatically improve. But there are certain people that, as crazy as it sounds, they're eating a clean diet, no ultra-processed food, no excess sugar. They're eating, some meat, some vegetables, some fruits, and they remove those things, the fruits and vegetables, and their health gets better. And I'm like, well, if it works, it works. Who am I to say that they're lying to me? And I've seen that, ad infinitum at this point, thousands upon thousands of people.
If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.